Hey everyone, you are listening to the CP Physiques podcast, episode 5. Today I am joined by Jacob Templar from the Strength Guys, who has a PhD, if I'm right, in physiotherapy.
Clinical doctorate. It's a little different in the US.
Yeah. So first off, Jacob, I'll let yourself do a bit more of an introduction of yourself, just to go a bit more into your background, how you got where you are, and things like that.
Yeah. So I started physical therapy school. I went to Utica College, which is in upstate New York. So I was born and raised in upstate New York. I used to play some sports like football. I played a little bit of rugby too, here and there. I went through, traditional physical therapy training, and then started working in outpatient physical therapy setting. I got into powerlifting and a little bit of bodybuilding when I was in college after I stopped playing sports. So for my interest in strength and conditioning came from, as well as from playing sports and training for that. So when I was in grad school, I used to read a lot more literature specifically on strength and conditioning and things like that. Did some powerlifting competitions at a fairly mediocre level, and from there started working in outpatient physical therapy offices. So I used to work at a practice where it was very surgical oriented, and we saw a lot of people post surgical, and I worked a lot with spine treatment there. Since then I've moved to a different city in upstate New York, and we're more of a one-on-one private, the owned clinic, therapist owned clinic, where we see a combination of things from musculoskeletal, orthopedic type things to chronic pain issues or things where people have been through kind of the gambit. In that process of me moving, I started working with the Strength Guys. Just through some mutual connections, I kind of started talking with Ben Escrow on social media, and he said, "Hey, this seems like you could really help us out." And he pitched it to Jason, who's the president and founder of the Strength Guys, and then we kind of did some test runs and to see how things went, and it kind of worked out, and now we're plugging along. And I've worked with some of our fairly well-known athletes before, and done a lot to help us mitigate and prevent injuries from occurring in the first place, with educating coaches and things like that too.
Yeah, from what I've seen, that seems to be quite a stance that a lot of different coaching companies are going down now, like Revive, Stronger, 3DMG are now working with physio, if I'm right, as well. So it seems to be quite a common thing these days.
Yeah, yep. It seems to work naturally well in that kind of setting, and we can do a lot of things without crossing our too many legal boundaries to help people out.
Yeah, so is that all done online or in person, or?
Yeah, so most of us would do things online. I know some of them have things where they may have a business where they are physical, a physical therapy, like a rehab specific, and they'll pay for that, versus we tend to do it more as we're coaching. I'm joining on with their coaching team to start with management of things within their program, versus treating them specifically as a physical therapist.
Yeah, so it's sort of more consulting the coach in terms of where to go within the direction of the program, or?
Yeah, how I might look at things or modify things that would help them get back on track, and may it's kind of with some supplements, it says has to say it's not intended to diagnose or treat any conditions, but we know certain things can actually help with some medical conditions anyways. Yeah.
So in terms of injury prevention, I'm just talking at the end for the sort of general athlete, person who trains. What do you say are the main sort of go-to aspects for how to prevent an injury? Sorry.
Yeah. So, I mean, a good approach that I would use is like similar to how, Eric Helms is known for like his pyramids of
Yeah.
nutrition and strength and things like that. It's similar like of those respects to where like, at the bottom you're going to have like sleep and hydration and nutrition, um, proper load monitoring and
Yeah.
management where people are
Program.
taking like, yeah, good programming. Like if as long as you're taking your tapers when you should be, or paying attention to, okay, well, maybe your sessional RPs are going up. Well, that's usually a good sign that you should probably be backing off a little bit for a week or two, depending. That's really paramount initially. And then from there, that's when we get into more specific things where it's like, okay, maybe like specific types of stretching or adding more volume to like this type of movement or modifying movements more so, may be more appropriate from there. Because just because if something hurts doesn't mean you should completely stop or like
Oh, yeah.
stop training, but there's other variables we can modify.
Yeah. So is there any common mistakes that you see people going to, which then leads to them getting injured? Is there anything that comes up quite often? Or
A lot of it's probably spending too much time on like things that don't matter as much,
yeah,
and not enough effort in the things that matter more.
minutia,
So
yeah.
like foam rolling more than you probably should and relying on that, or like like uh, things like where people like miss workouts, say, and then they'll try and make up for that volume like in one whole workout when maybe they didn't get appropriate sleep or nutrition and things like
Yeah,
that.
yeah, sort of combine and work out.
Yeah. um, just kind of ignoring the most basic things and trying to compress everything into like a shorter time span.
I think in general, though, especially in terms of the strength and bodybuilding, a lot of people can focus a lot on the minutia rather than
Hmm.
focusing on the main sort of basics. Is
Yeah. Yeah, and like one of the things too is that when you get focused on that minutia, you don't realize that like you're not seeing like a bigger picture.
yeah,
And a lot of people will try and do some things maybe they're not ready for yet too. Like another big one that I see is like some people will say, I don't know, say you're like squatting, let's use that as an example, and you're squatting once a week right now. Well, somebody might look at someone else's program or like what somebody says and not put that into the context for themselves. And then they'll go, oh, well, I'm going to start squatting like 4 times a week now,
yeah.
from like 1 time a week. And that's can be a big difference in your tonnage and things like that.
I found that especially. I think it was recently. Jeff Nippard posted a YouTube video where he's now training 5 days a week at full body. And it sort of
Hmm.
makes me think, well, what if I tried? But then Jeff's been lifting for 10 plus years. So that works for him because he's so advanced. Whereas someone who hasn't been training for that long, there's probably no need to really go to that extreme.
Yeah, it's kind of like they look at these ideas and principles and see what somebody else is doing and not saying like, okay, but where am I at? And then sometimes assessing themselves in the wrong position. Like you may think you're more of an advanced lifter or like an advanced intermediate when maybe you're still novice or intermediate. Um, and then also people not like using some of the like ideas that Eric and other people have presented to the appropriate way. Like they look at this pyramid and go, they kind of don't start at the right place and make sure they're consistent at the bottom parts before then going up
Yeah.
to the next levels.
I know I'm just linking this to um, MCP, which is what this um, podcast is about. I
Mm-hmm.
found myself of getting quite guilty of thinking, so if I train my left side more often, if I do more volume on this session with my left side, and the programming can get quite complex when it's probably not really needed.
Yeah, especially with there's certain neurological things we know about how strength training works, where you can constrain somebody's, like, say, one side and have them train with the other side, and you'll still see adaptations neurologically across both sides because the way that it is carried.
I never actually knew that. I always wondered if there was any negative impacts of training one side, especially for people with CP. I know I heard on James Walsham's podcast, I heard Brad Loomis on talking about that because he's got scoliosis as well. Saying I think it was Dr. Eric Helms tried training one side on his delts, and he found some then issues with his posture from doing one side. So I didn't really know. It was just sort of in your head. You think, well, if someone's got a weak part of their body, they train it more often, they do more volume. So then you use that for me to my left side.
Yeah, and that would be typical. Most of the research in it where they're like training an opposite side is like if somebody's, say, in a cast or had a surgery or things like that. And but we can see from a top-down perspective the way that affects your brain and your spinal cord. It's still like you're using that pathway, so it has a carryover effect. Most people know it as like they call it like crossover effect, or I think Brandon Roberts, who used to be with us at Strength Guys, him and I talked about it, and there's a phenomena that's understood in exercise physiology where they found similar. So it's not like there's a lot of strong evidence that like all of a sudden if you train one arm, your like 1 rep max is going to go up on the other arm like significantly. But if you're not using one side at all, it'll still have a benefit for you.
Yeah, interesting. I didn't actually know that. That's pretty insightful. So, in terms of injury prevention, more specific to CP, do you think is there anything that is more important to cover with CP, i.e. stretching, i.e. warm-ups, things like that?
It would be some of the similar principles. So like some of the research, because we talked about this before, and I just sent you so you have for show notes, covering that stuff. It's like a lot of the similar principles that we see in general population still apply towards people with CP, even though the motor areas in their body maybe didn't develop the way we would normally expect, or they had some kind of trauma when they were in utero or as a child that led to some of the problems they're having. Main focus is like being balanced in your movement, so you're not going to fall or drop something on you or things like that, or getting into your warm-ups more with a gradual progression, paying attention to how you feel on that day or how you felt over that week. Just
on the note of doing warm-ups, do you feel there's more to do more sets compared to the average person?
There may be, if you have some difficulty with, say, like, I've had some patients where they feel more comfortable once they've gotten into a specific movement and been able to do it a little bit more, starting at lighter weights and then working towards heavier weights to feel like some comfort in, be it like with your grip or how you're able to balance your leg if you have lower, a leg issue, as well as like maybe with your hand. I know for some people that makes a bigger difference. And it's more of like getting the comfort and feeling of the groove of that movement before you start doing like your heavier working sets. So that way you're not feeling like, I don't feel quite balanced or the way I would like to during the set.
Because I was just thinking in terms of the neural sort of muscular links, maybe by doing more warm-up sets, you then the likelihood of getting more contractions when you do your working set maybe will be increased. I know from a personal experience, when I did sort of the low volume, high intensity approach after my 2017 season. This was just for 1 or 2 weeks where I didn't have a set program straight after prep. My coach's reasoning for going back to high volume was that if, say, let's just keep the numbers simple, if I did a set of 10, 5 or 6 of those reps might only be contraction. So by doing more working sets, you're then increasing the number of contractions you can get if every rep isn't 100% accurate. My thought there was maybe doing more warm-up sets is then going to lead to an increased number of actual good reps that you get in the working sets.
Yeah, and that has some sense. That makes, like, logically, that makes sense, because you're adding more volume and more practice in the movement, even if it's not, say, like a hard set. That's still going to have an effect and carry over in how you're able to, like, pattern a movement and understand, like, how to carry it out, which we seem to find that in CP in particular doesn't increase spasticity, and anything may help someone become more functional over time.
Yeah, and it's as well, I know there's quite different opinions of whether you do the isolation work first before the compound work or vice versa. Would you see that by doing an isolation exercise first, maybe may make the compound safer for one, but also increase the accuracy of the reps, get that neuromuscular connection before you then go on the compound? Would that be along those lines?
Yeah, I mean, I could see with some people, because then we're like, that may fall into more like, say, where I'm in like my rehab setting, where like I see with some people on a case by case basis, I might say that might be more appropriate, like get you into like comfort of like, okay, I feel warmed up, I feel like more prepared to then do that compound movement, and those like that as a but as a generality, I'd probably say that most people, I'd have them start with like the compound movements. They put more energy into a movement that you're going to get kind of more of a bang for your buck out of.
Is that down to the fatigue as well, maybe? Because if you're pre-exhausting with an isolation, especially on a compound where that requires some form of balance, say a squat, a deadlift, a row, then they coordinate because you're already fatigued. In my head, the coordination won't be as on.
Yeah, potentially that would be the concern there, is that, but on a case by case basis, if somebody honestly just feels better if they're doing isolation movements before, there's no rhyme or reason that we have to do that. I mean, especially like Schoenfeld's study recently about like the effects that it has, getting into the minutia of like growth, right? Like he had that study that showed maybe potentially a tricep is a bigger muscle than a pec is. So if you do a tricep isolation exercise, maybe that requires more energy and input than if you're doing like something that's more pec dominant.
Yeah, that's it. That's interesting. I don't think I've seen anything on that latest research. I know the main research I'm aware of by Brad Schoenfeld is more the training volume study that's been heavily debated.
That one's more cited. Let's see. I'll look up and then we can include it. The Schoenfeld one about the tricep.
That's interesting because it's, for me, it was one of those things where there's upsides and downsides of doing the compound work before the isolation work and vice versa. In my head there, maybe pre-exhausting with an isolation exercise, then potentially using that will then lead to using less weight with the compound. But in my head, I'm thinking, will that then be more beneficial potentially for reducing the effect on the CNS and systemic fatigue because you're using less loading.
Yeah, I mean, ideally, what you'd want to do is given, it seems to be that with CP, even some loading principles still apply very similarly. And that's probably because the nervous system is so adaptable. And we even see that with people that have had strokes, right? Like you can have these large, for them, kind of event injury, so to speak, but the brain is still able to adapt and overcome these issues and like relegate different functions to other areas. So the more we stimulate that area, technically with more like volume total, potentially you could see a better carryover to somebody's like abilities to do things, technique in a movement, as well as the execution of that exercise. Because the main concern would be like balance, falling, different things like that. That's a concern for injury, because if there's a certain way that you're doing something because of an asymmetry, because of CP, does not necessarily mean that you're going to, say, injure your back or like something like that, because that's the way you daily go through your life anyways.
Yeah, so that's quite interesting because I'm very over-critical of my form, maybe to the point of where I'm chasing form that's not really going to ever be achievable. Particularly in compound work, deadlifts, for instance. I'm trying to achieve this nice, straight, neutral spine. But realistically, the chances of that ever actually being achieved are probably pretty slim, whilst keeping load at a weight that would work the muscles that I'm wanting to work.
Yeah, and I mean, technically, like that's what we're considering too. Like because you're more into the physique realm, right? Our technique, we want it to be putting the load on the muscles that we're intended to be putting them on. So that's going to be the goal of the technique in that situation. For powerlifters, it may be, okay, what can I do where I'm able to consistently reproduce this technique? It's the most efficient. Move the most load that's efficient for the way that my body is set up, and to competition standards.
Because I found that I was doing safety bar squats for a while, but I was starting to get some depth, but I just wasn't feeling it at all in my quads. It was mainly in my lower back. So I think there'll be a lot of people listening to this who are more or less newer to resistance training as well. And I see a lot of people getting emotionally attached kind of to an exercise, say a squat, when it's probably not the best exercise for quad growth or even hamstrings, glutes, because they're not achieving a full range of motion and the form isn't sort of to the standard where they are actually using the muscle.
Like we want them to be able to learn it, but like you don't want to become, unless you're doing it for competition, right? You have to be not emotionally attached to a lift, especially in physique realms. Like, I mean, I've never done a physique competition, but I dieted from, I dropped 30 pounds. So that would be like near like 15 kilos, right?
14, 15.
So like I can tell you that wasn't a fun experience, and I had to not be emotionally attached to my deadlift and squat because I had to switch to other variations just to be able to feel like I wasn't gonna like die to go in and like lift, not because I couldn't do it, but because I just was like so fatigued and like ready to be done.
Well, I've noticed that this year with COVID, I went into COVID leaving the gym, and then I've dropped 20 pounds, and I've now came back in. A, I haven't done the exercises for a while, so my strength will be down anyway, but B, I've lost that weight, so it's quite hard mentally to sort of deal with not being able to move as much weight.
Yeah. And a lot of people's tolerance to like tonnage, so like amount of total work may be different. Like you're not going to completely lose it as long as you're continuing to do some kind of physical activity.
No, yeah.
But, you know,
I was using resistance bands, so that sort of kept the motor patterns in kind of. On the subject, just going back a bit to the squats.
Yep.
If so, how is there any research to suggest how long, if maybe it would take someone with CP longer to learn a movement? Is there any sort of research on how long to keep it in the program for before, not sort of giving up, but is like,
yeah,
what would the time frame be of being like, this is the point where I now probably need to switch it up and go for a leg press or something like that?
So a lot of what I have read was comparing general activity guidelines to with people with CP. If somebody is not trained, right, you can actually get away with doing something less frequently than guideline recommendations and still see a benefit of that technique. And typically, you know, you could expect you should really stay consistent with something probably for like, you know, 2-3 months before completely abandoning it, even if it's like changing constraints and things like that.
Yeah, that's interesting.
Yeah, because that seems to be, and it's probably because most of the research on CP is going to be done in people that are less than active and not meeting some of these, like even close to some of these exercise guidelines. So typically you would see that people that are farthest away from those are going to have the most robust response once they start doing activity.
Yeah, I found out when I've tried to delve into some of the research that a lot of it was done on children as well. So teenage range of age, sorry. And as well, like, if anyone's listening to this with quite big strength goals or getting on stage at some point or things like that. I mean, in general, a lot of the research, even for the general lifter, is pretty. It's done on students and things like that, so it's not really done on experienced lifters. So it's, that's one of the main criticisms you hear from the sort of quote unquote bro sort of crowd, that all the research is done on people who haven't trained before or are pretty new to training. And that's the same when looking at CP as well, pretty much.
Yeah. Yep. It's a lot of it is going to be in people that are untrained or not as active, and that's probably why they have a significant robust response. But it's also a good thing to see because it's kind of dispelling some of these misunderstandings and kind of dogmatic ideas that are currently existing around CP.
Yeah. I know the main thing that I've seen when reading up on research is to do with strength training was previously criticised for CP or spasticity, but now it's sort of been dispelled.
Yeah, and there's been a few rocks thrown in the glass houses of stretching within the last 10 years as well. Where, say, when I was getting out of college, my last year of graduate school, we had a professor who was very well known, like internationally, for his work in like hospital physical therapy. And he showed us a big review that he thought was well done. And it kind of showed that stretching really doesn't do a whole lot of anything.
So I was wanting to cover stretching a bit in this podcast as well, because it's something that, I mean, as a child, I know that it was something that I was having to do a lot.
Yeah.
And I kind of, being the typical child, when you told to do something, you don't want to do something. So that sort of
Yeah.
stuck with me in later life. My not hate for stretching, but I just it's not something that I really enjoy doing. Like, and it's probably something I'm guessing that I should be doing more. But is there any research to suggest, like you've just said, that it's not as beneficial? Is there any specific times, i.e. pre-workout, post-workout, or on a rest day, things like that, where we should be doing?
Yeah. So a lot of it, like, so if we're looking at it in the context of injury prevention and management, there's no real, a lot of stuff when they start to compare like stretching to other types of programs, right? They found long time ago now that dynamic stretching, if anything, maybe not as beneficial before working out because of changes that it causes in the muscle, to where you're able to like sense certain aspects and even output force through the muscle. They found that there's a significantly more benefit from doing strengthening, like strength training and dynamic warm-ups for reduction of injury and things like that. So strength training comparatively to like stretching and like balance training, and collegiate athletes, they found that strength training reduced injuries by like a 70% comparatively to like stretching, and balance training was like maybe like 5 and 10%. And then there's programs like like some of the soccer, or for non-Americans, football warm-ups, like the FIFA 11 and things like that seem to have some benefit as far as reducing the likelihood of like ACL tear, but it also seems to have to a lesser degree that is not as well researched, an effect at reducing the likelihood of like a leg, like lower extremity type injury anyway. So it's like these more active dynamic type things that like working into the movements that you want to be participating in seem to have more of a benefit than trying to spend countless time working on certain mobility exercises. And if you don't need that specific range for like technique, for competition or things like that, it may be more worthwhile to put your efforts into other things to help your recovery than it would be to do those types of things, because the range of motion you gain from stretching is only going to be specific to the stretches you're doing and within a context. Like, right, if you just stop doing those stretches, you're probably not going to maintain that, because you're not given the body a stimulus to say like, why do I need to keep this available range?
Yeah, I was told that in my rehab of my wrist fracture last year, because I had my wrist fused, fractured it, but the bone was too close to the plate to heal, so they had to move the plate and things like that. But my arm wasn't a full arm cast, so my left arm does tense up quite a lot anyway, and I can't lock out the arm. But it was on the line of where it possibly, the range of motion had reduced due to being in a cast.
Yeah.
And the physio that I seen there said that it would only be sort of short-lived, because I even questioned doing PNS stretching, which we covered briefly in my level 3 MPT course. And they said that unless we're doing it sort of every day, there's not really going to be much use to it.
Yeah, and like in a rehab context, right? If somebody's lacking a certain amount of motion, the goal there is to try and increase it to their kind of normal level of motion. It's not, and we're not necessarily like changing the length of their tissues. It's making certain positions and movements much more tolerable to do, and more to their kind of normal level.
So for me, Matt, just go more specific. I'll just use myself again as an example, just in terms of range of motion. My main issues in terms of range of motion would be my hip flexors and my left rotator cuff. So for instance, I couldn't do that with my left arm.
Yeah.
So that then affects in terms of in the gym, that then affects for the hip flexors, it affects squatting, leg presses, any sort of quad movement. And likewise for the rotator cuff, any pressing movement, particularly the more the incline, then limits that. Is there any mobility work that can help someone in I know you've said it's only really going to be specific to specific strength training or specific sports specific events, but is there any benefits from a hypertrophy aspect? Is there anything that could improve that, or is it not really something to be concerned about?
So like stretching in the way that we often think of people stretching doesn't seem to have as much of an effect on hypertrophy, but there is currently like I don't understand enough about this to talk specifically on it, but I know I've talked with like Brandon about it, where there seems to be some aspect of like say the eccentric component of lifting, or like the impact of like a Romanian deadlift or a Nordic curl or an eccentric part of the pull-up that can induce some kind of hypertrophic effect when it's weighted in that aspect.
Yeah, interesting. I just sort of wondered for me, and I think I know I've worked with a handful now of P, but with CP, and the hip is often quite a common issue for squatting and things like that.
Yeah.
I didn't know if I know that will potentially have some impact on the amount of growth that they can get in their quads, but I didn't know if there was anything that if improving that range of motion would then
so
impact on the amount of growth.
So that would circle back kind of like to our discussion about like technique, as far as like for a physique standpoint, if you're trying to put stresses on a certain spot, if your technique is not able to be where maybe you think it should be, or where you're feeling the specific muscles you're trying to more target, then that's where maybe I'm looking to achieve a certain type of technique, or I'd like to be able to do this exercise and I can't because of a certain restriction in their motion. Well, that's where, now let's work on some of those mobility aspects to say, okay, now I can do this in a way that I deem to be more appropriate, or I actually feel like, my quads, I feel that more now when I'm doing that lift. Things like that. That's where that stuff would be more useful. I think in most people's programs, versus like just thinking that stretching yourself is going to help to prevent a future injury.
Yeah. Is there anything post-workout maybe that athletes with CP can do to improve their recovery and for the next session and things like that? Or
like besides just like the basics stuff, there does seem to be like a mild amount of research that like some specific massage and like even like I think it was like heat based, like being in a warmer temperature for a while, like has some effect on hypertrophy, but it's such like a minute amount if you're not already already taking advantage of all the other things. You may not notice a significant difference in your growth. And specific to CP, if you have a certain type of range of motion you're looking to achieve and maintain, then definitely doing certain activities, like say if you worked out in the morning, you want to achieve this specific squat, technique, then doing, other daily activities that you are getting into those positions would definitely help you to maintain that kind of more, because then you're just stimulating those motor.
More, so because I've always wondered as well whether an athlete with CP, so the general consensus is that the more often you sort of train a muscle, especially for strength and growth, the more optimal to an extent it could be. But I've always questioned whether potentially someone with CP, I know there's the range of different conditions with CP can vary, but would that impact on how often you can train a specific muscle groups, i.e. would it take longer to recover?
Not necessarily, because more of it is to do with the neurological aspects, right? And our nervous system is very adaptable and can adapt within several days to seconds, depending on what kind of like where we're looking at. If anything, doing things more frequently but at a lower volume, like especially if you had issues with, say, like a daily task, right?
Yeah.
There is some moderate level evidence that says like a constraint-induced therapy can benefit the functional use of, like, say, an arm or a leg or something like that, where they literally take your other arm and put it in some kind of like cast or like wrap to force you to use the side that's been most affected, to then, because that forces your brain to adapt and get better at using that specific limb.
Yeah, that's one thing that I've always half thought about doing, but never actually really stuck at it, would be, because my CP one side would be using my left hand as much as possible, because I notice even things like grip, my grip on it deadlift, the left hand feels like pretty lightweight, unless, I mean, it's more about the thickness of the bar. So I find on, say, a lot of machines, if the handles are quite thick, I find it hard to grip. So I, especially on rowing movements, pull down movements, my grip would fail before my back fails. I've always wondered whether using my left hand more would be a way to get around that without having to always rely on things like straps.
Yeah, I mean, there's the potential for that, and always what you would see is that the difficulty with constraint-based therapies are literally like not allowing somebody to use one of their arms or like their hand, right? So there's a big challenge with getting people to actually consistently do it for long enough to see like a significant benefit from it.
Yeah, because that's always been one concern for me, even in the future. If I ever broke my right arm, touch wood, I don't, I would then be pretty limited to even eating. I wouldn't be able to even feed myself really if I think about it, because my wrist is A-fused and I've never had any rotation of my left wrist.
Okay. Yeah. I mean, it's interesting because like because like you said, everybody with CP is going to have a little bit, I've seen people with more and function to where they like have very minimal issues, to where I've seen some people that have very large issues that don't allow them to do like specific things very well.
Yeah, that's interesting. Yeah. I've just found that I do make more of a conscious effort now to use my left hand a little bit more.
Mm-hmm.
And since I got into weight training, I probably have used it a little bit more. And grip wise has improved. I mean, I competed in a powerlifting competition without straps.
Mm-hmm.
So there is work that it's not an impossible. It's not the extent of where it's going to be unrealistic to expect improvements.
Yeah, and you've even seen like there are powerlifting games where there will be people with, say, different issues like CP and Down syndrome and like a lot, maybe from neurological issues or traumatic issues, you know, are not able to use their legs or like things like that. And I think, you know, if we have competitions for it, it means that people with those issues can still get stronger, because otherwise you would not be able to consistently compete.
Yeah, that's it. Because for me, I mean, I dabbled a bit once or twice with competitions in terms of powerlifting, but I just did the deadlift because on the bench press, my left arm can't lock out.
Okay.
It gets pretty close, but like I said, the range of motion in my elbow is somewhat limited. And on the squat, my rotator cuff issue, I couldn't physically get underneath the bar. Just on the terms of range of motion, just quickly, because I'm aware that time's getting on now, just to wrap things up on this, would limited range of motion impair someone's ability to grow muscle to an extent? Because I hear a lot about active range of motion and things like that. So if someone could do what you would typically see as half a rep that somebody else could do because of their CP, to what extent do you think the hypertrophy would be impaired, would be limited?
It may be limited, right? Just because of the like achievable like activation of the muscle, or like, you know, going through more of a full range of motion has an effect on the strength curve, as well as like different effects of the eccentric and how much force that different parts of that muscle is able to kind of see, kind of.
For the lengthening of the muscle and shortening of the muscle would be my...
So it would have an effect on it, but to the extent of how much it would affect that, say I couldn't accurately say maybe how much. I think it would be more dependent on how much motion you have limited and how much of that range are you able to use when you're working out.
Because one thing that like I said at the start of the podcast, that I quite often see is just from an observation would be people doing exercises that possibly don't suit them. They could possibly get more range of motion on a different machine or a different exercise. But I didn't know to what extent range of motion comes above most things to get growth. If it was as important as I believe it is.
Yeah, I think it's definitely a factor that goes into it, right? So if you're able to achieve more range and things like that, I don't know. I think there's differing opinions. Like say Mike Israetel has an opinion about how much range you should be aiming to achieve to elicit growth, right? And there are differences in studies. We can see that, you know, certain types of, you know, depth of squatting has different effects on muscle growth. But to say that one way is better than the other for everybody, I don't know if that's necessarily true. I would tend to err more on the side of, if say in one movement you can achieve a greater range of motion than in another, I may err more towards like doing the movement with more motion available.
I've always been a big proponent of range of motion. I think that stems down to myself potentially not achieving full range of motion on specific things, and in my head I've linked that to limiting the amount of growth that I achieved in the past, and things like that. So a big thank you for coming on the podcast. We'll wrap things up there. If the listeners were wanting to find out more about you, where can they find you?
Thanks for having me on. I really do appreciate it. And my most available place is definitely on Instagram. I have other platforms, like I use LinkedIn professionally, and I have a Facebook page that's the same name as my Instagram handle. But My name on Instagram is @strengthandevidence and then _physio. That's where I'm most widely available for if people have questions or just want to follow along and see things that I post about or ask, questions that lead into posts or videos. That's the best place to reach me.
Great, thanks for coming on, and thank you to everyone that listened to the podcast. If you can, please give it a like and a subscribe on YouTube and a review on iTunes. Thank you for listening.